Hello, everyone. My name is Jeremy Holston. I am the director of the LGBT Chamber of Commerce of Illinois, and my pronouns are he, him, his. I am super excited to be with all of you today as we continue to share information about one of the new member benefits that we have available through the LGBT Chamber of Commerce of Illinois, through our partners at IXSolutions. For those of you who might be joining us for the first time, the LGBT Chamber of Commerce serves as the premier voice for nearly 50,000 LGBT business owners across Illinois. Today, we have a network of nearly 300 member businesses who we support with networking, marketing, professional development, and advocacy, as well as access to the LGBT Business Enterprise certification. We have a couple of really great events coming up where I hope you will join us. Today at 5:30, we'll be hosting our Latinx Networking Series event. We'll have the opportunity to hear from Latinx business owners and entrepreneurs about their life and experiences. We'll also, on the 19th, have our Women Networking series conversation. So be sure to join us there to hear from women in our LGBTQ community about their experiences as well. And then last but not least, on December 1st, we will be hosting our end of the year 2020 Winter Soiree. Tickets are $60, where each person will get a link to the event, as well as a tote bag, which has a lot of good goodies. So a taco kit, a sangria, a cutting board to cut up your fruit, and a whole lot of really fun things. And so also $10 of each ticket will go towards the AIDS Foundation of Chicago. December 1st is World AIDS Day, so we are excited to celebrate with AIDS Foundation of Chicago to help them in meeting their goal of getting to zero by 2030. And last but not least, on December 16th, Monday, we'll be hosting our LGBTQ Biz Bootcamp pitch competition. So we've been hosting a business boot camp for 8 weeks for new and early stage LGBTQ business owners. So we're excited to put all that experience to the test and witness them wrap up that learning in a pitch competition. So I'll drop some links in the chat section and hope to see all of you there. So Christian, I'll turn it over to you to help us take us into today's awesome session. So thank you, Christian, and for your partnership.
Thank you very much, Jeremy, and appreciate everybody taking the time out of their day to sit through this webinar. All those events are very exciting. So I'll go ahead and kick it off on our presentation discussing the benefits program to the LGBT Chamber of Commerce and the individual options now that we are in the open enrollment period. So my name is Christian DiVito. I'm a benefits consultant at IXSolutions, and along with me, another member of my team is Grace Haerr, who is our individual and marketing specialist. So I'll do a quick little commercial on who IXSolutions is, and then go ahead and jump right into the presentation. So we are a brokerage. We're located in Chicago, Illinois, right by the Cumberland Blue Line, so right on the edge of Chicago. We have over 30 years of experience in the industry, and we work with both businesses and individuals. We partner with other brokers, chambers, and to provide essentially insurance solutions to the end member. As I mentioned, we work with both groups and individuals. So during this presentation, we will discuss the benefits that are available through the LGBT Chamber of Commerce, the benefits program for business members. So that'll be the first half. And then the second half, we will dive into the individual options for anybody that's not part of a business. So we got some chats coming in. All right, perfect, Jeremy. All right, so just want to make sure I was not missing anything. All right, so this is the benefits program available to the business members of the LGBT Chamber of Commerce. So you must be an active member of the LGBT Chamber in order to get these benefits. So this is a great program that you can help offer to your employees quality coverage while saving significant money on premiums. So this is a tremendous benefit through your membership. So by being a member, you get essentially there's three-part offering with this program. One being discounts on Aetna premiums. The second part being Metlife, handling all the ancillary plans, special plans and pricing with Metlife. And then the third part is going to be with a third-party administrator, Flexible Benefits Service Corporation, that will offer discounts on COBRA and CDHP, so flexible spending accounts, health savings accounts, health reimbursement arrangements, those types of add-ons or products if you choose to set them up. So this program really covers all aspects of insurance through a business, and I'll go ahead and dive a little bit deeper into each one of these three products. So the first being the Aetna plan, which is also known as the Aetna Funding Advantage. This plan is a hybrid between a fully insured and a self-insured plan, which typically results in significant savings. The way that Aetna does determine their rates is based off of the medical experience of the employees. So it's going to be a little bit different than how you typically used to, where if you go with a carrier that gives rates just based off the age of the members. So when you have typically a healthier demographic or healthier employees within the business, that's where you can see very significant savings. And I love to see those types of businesses because that's where they can offer the lowest rates. Based off of that medical experience, Aetna will give a monthly premium to the business that will stay the same throughout the entire year. This monthly premium established by Aetna is used to essentially pay expected claims that do come up throughout the year. And if the expected claims do exceed that monthly premium that is set aside essentially for that annual premium, there is a stop loss in place, which means that the business will not pay any more than their set monthly premium. If the expected claims actually are below the set monthly premium, that's where the business can actually receive 50% of the surplus funds that are left over at the end of the year. Essentially, it gets given back to them in a check. It doesn't have to be used to anything specific. It's really just money that is provided back to the business. So you could use it for potentially the renewal for next year. Or you could use it just to provide employees a nice benefit. So this plan feels like a fully insured plan. It has all the benefits of a self-insured plan, but I want to emphasize that there is no risk on the employer side. It's all upside with these Aetna plans. Another part of this Aetna program is going to be the Attain by Aetna, which is a partnership with Apple. And Aetna, and this can I explain further on this, Aetna is very focused on the wellness of their members. So this Aetna Attain app is broken down into essentially three different areas. There is the staying active, which is typical with every wellness program, your everyday health and key health moments. By hitting all of these types of goals, you receive points at the throughout the year. So by staying active, hitting your daily active goal, not essentially just typical steps like how normal wellness programs are, but just by hitting your active goals, depending on however it gets set, it's very tailored to each member. You receive points. By making smart, healthy choices every day, you receive points. By hitting those key health moments, for example, getting an annual physical, filling a prescription, again, you receive points. And all of those points essentially go towards the price of an Apple Watch. You receive an Apple Watch as every member, even dependents 18 and above, will receive an Apple Watch if they are enrolled into the plan. And there's a small activation fee. It's around $15 that the member will pay just to activate if they do not have an Apple Watch. And all the points that they receive by hitting those goals in the previous screen, those points essentially translate into dollars that they are paying off this Apple Watch that is given to them up front. If the member already does have an Apple Watch, the points that are earned throughout the year are actually translated into essentially points or dollars that you can shop in the Attain gift card store. As you can see, major retailers. So the more active you are, the more money you earn, whether you're paying it towards your Apple Watch or paying it just to use for gift cards. All right, so that was the Aetna portion of the benefits program for businesses. The second part is going to be Metlife, as I mentioned. So Metlife handles all of the ancillary benefits when dealing with insurance. And pretty much what that means is everything but medical insurance. So they're gonna offer dental, vision, life, supplemental life, disability, both long-term and short-term disability, as well as a legal plan. And so through the chamber and the benefits program, you can receive special plans and pricing on these benefits listed on the screen. And then the last part, the third part, as I mentioned, of the benefits program is going to be with Flexible Benefit Service Corporation. They are a third-party administrator, and if you decide to go with either an Aetna or the Metlife plan, and you would like to set up a health savings account or maybe a flexible spending account on top of that, just as more tax advantage and unique ways to help save money on top of this program. By using Flex, if you're over 20 employees and have COBRA as well, there's typically admin fees that come with servicing those, and Flex will provide discounts on those admin fees just by being a member of the chamber and participating in these plans. So who qualifies? Obviously, as I mentioned a handful of times, outside of being an active member of the chamber, any business with 2 to 100 employees are eligible for these benefits. And Aetna they will be the one carrier that will verify membership at the time of submission. And how to get started? Obviously, we'd love to be able to help. Contacting us at IXSolutions. We're very familiar with this product. We work with a handful of chambers and several businesses across Illinois. We can help get a quote just by providing that basic census information. Aetna will provide what they call an illustrative quote, which will show essentially all the employees if they were in perfect health. Obviously, to get that true underwritten rate, Aetna will require individual medical questionnaires that can be completed either by the standard printing them out and filling out. It's a 2-page questionnaire, or there is an online form that Aetna provides at no cost, where employees can sign. They get an email, they log in, and they fill out their medical questionnaire online. This is also a more secure way, and more employees do feel more comfortable filling out this way because there's less hands on it. The employer doesn't see it, us as the broker, we don't see it. It goes directly from the employee to Aetna to provide those underwritten rates. And then if you do decide to move forward with any of these plans, obviously we're here to help and support and service throughout the entire year, as well as anything that comes up throughout the year, billing, just questions. We're here to help with any type of inquiries, as well as the renewal for next year and helping with that. So that was going to be the benefits for the business side. But as we all know, we are during the open enrollment period for individuals. So if you're not part of a business, we can still help individuals with insurance options as well. So although these are not going to be special plans available through the chamber, I want to make that clear. It's unlike Aetna, where we can provide those discounts just by being a member. So although these are not special plans, this is a very important time of the year, and we're more than happy during these confusing times. So I'll turn it over to Grace, our individual specialist, that will touch on the open enrollment period options for both individual and families during this time.
Thanks, Christian. Okay, so this is for all of you who do not work for a business with 2 to 200 employees. So for those of you who don't have access to healthcare through business or group, this part's for you. Open enrollment period. So this runs at the end of each calendar year from November 1st to December 15th. And enrolling during this time guarantees you a January 1st start date for your plan. This is the only time of year that you can change plans or enroll in a new plan. Next slide. Outside of open enrollment period, individuals must have a qualifying life event to enroll. These can include a change in family demographic, a loss of employer-sponsored coverage, or really any involuntary loss of fully insured coverage. This loss of coverage opens a 60-day special enrollment period window for the individual to get coverage. Proof of this qualifying event would be required from a carrier, such as a termination letter from an employer or a certificate of credible coverage. Next slide. Healthcare Reform 101. So health insurance is regulated under the Affordable Care Act. The Affordable Care Act is a law originally created to make healthcare more accessible and more affordable for everyone. So it means that regardless of your current health conditions, you are guaranteed coverage under the Affordable Care Act. You cannot be denied. It also means that all plans must cover these 10 essential health benefits listed. So no matter which plan you choose, it's guaranteed to cover vaccinations, prescriptions, preventative care, mental health services, maternity, and more. Now, just keep in mind that this is only if you're receiving these services in network. This does not mean these services are now completely free. Okay, on exchange versus off exchange. These are buzzwords you may or may not have heard before. But basically, another way that the government works to make healthcare more accessible for those who can't afford it is by offering premium tax credit subsidies as well as cost sharing to individuals with low income. To qualify for a subsidy this year, your annual income needs to fall between roughly $17,000 and $50,000. That's AGI. An annual income less than $17,000 would actually qualify you for Medicaid, which is a program through the government that you opt into. Plans that are subsidy eligible are considered on exchange. So the government selects certain plans to be subsidized. So there are actually less plans available on exchange or on the marketplace, like healthcare.gov, than there are off exchange. Both are subject to the Affordable Care Act, so both on and off exchange plans must cover the 10 essential health benefits we touched on, and you would have access to both through our brokerage, IXSolutions. Okay, major medical plans. So everything that I've covered so far applies to major medical plans only, sometimes also called fully insured. So that goes for the tax credit subsidies, the 10 essential health benefits, as well as the open enrollment periods and special enrollment periods. Next slide. So short-term medical plans are not subject to an open enrollment period. So whenever major medical is not an option, we can offer short-term medical plans to members. So if you miss the enrollment window, you don't have a qualifying life event, these plans are going to be available year-round. You can enroll in a plan any time of year for a max coverage period of 6 months in Illinois and starting as early as next day. So literally enroll today, coverage starts tomorrow, up to 6 months. One thing about short-term medical plans, they are not compliant with the Affordable Care Act, so they do not have to cover pre-existing conditions. This is also how they can be sold at any time of year, and also it makes them more affordable. On average, these plans are about less than half the cost of major medical. Okay, so both, this is important. I want to mention that all health plans that I've discussed, major medical and short-term, cover COVID-19. So all carriers available in the state of Illinois have committed to covering diagnostic testing related to the coronavirus. Okay, so everything so far applies to medical, major medical, short-term medical, but I just wanted to show a list of all the other products that we can offer, including renter's insurance, even pet insurance, for those of you with furry family members. Okay. All right, 2021 industry updates. So basically every year before the open enrollment period begins, insurance carriers have to decide two things. Are they going to offer a product at all? And are they going to offer the same products as last year? Just an example, the carrier that Christian was touching on earlier with the group benefits, Aetna, they actually exited the market, the individual market, in 2016. So they don't offer individual or major medical plans, only group plans. We are excited to announce that a new carrier will be joining competition in Illinois, Bright Health, as well as Blue Cross Blue Shield will continue to offer individual health products in 2021, and the other individual carriers available in the state are Ambetter and Cigna. So Bright Health. Bright Health plans are considered an open access network. It's basically a hybrid between an HMO and a PPO. What that means is you have access to any Bright Health care partner, those are listed here, without needing a referral. So you have, like a PPO, no referrals are required, but you are restricted to the Bright Health care partners. So like an HMO, restricted to that network. One difference here is, unlike a traditional HMO where there's no out-of-network coverage, Bright Health offers a national urgent care network, meaning you can visit select urgent care facilities anywhere in the country. So if you're traveling and it's not necessarily an emergency, but you need to see a doctor, you can. Bright Health care partners include North Shore, DuPage Medical Group, Amita Health, and Edward Elmhurst Hospital. One thing I want to note here is you don't have to designate a single care partner when you choose Bright Health. You can access any of the ones listed. You can receive care from a primary care physician at DuPage Medical while also going to see a specialist at North Shore. So the reason that they've done this with these plans is to help keep costs down. And as Christian mentioned in the beginning, these plans, compared to like a Blue Cross Blue Shield plan, the premiums are about $100 less a month. So they've entered the market this year and they've come in really competitive with their rates. Now I'll touch on Blue Cross networks. There are no new network offerings with Blue Cross Blue Shield. If any of you are currently enrolled in one of these 4 networks, the same 4 networks will be available. First network is the Blue Choice Preferred PPO. This is the largest network. It is also the only PPO network available in the state of Illinois. It doesn't mean you're covered no matter where you go in the state. It does exclude major teaching hospitals such as Rush and University of Chicago, as well as North Shore. This network does include Northwestern Memorial, which is new as of last year. Previously, Northwestern only worked with the HMO network with Blue Cross. And this is also the only network that gives you access to a Blue Card, which gives you coverage outside of Illinois. So similar to what I talked about with Bright Health, but in this case, you could actually see specialists outside of Illinois with the Blue Card. Okay, so what else? Really quick with the PPO, it is the only HSA compatible plan with Blue Cross, and in HSAs, as Christian mentioned, through flexible benefit, they can also service individual HSA accounts for you all. The contributions for 2021 are $2,600 for an individual who opens an account and $7,200 for a family. Okay, Blue Precision HMO. This is the largest HMO network. In 2021, this is no longer going to be available in McLean, DeWitt, and Livingston County. Members living in those counties will be mapped to the Blue Choice Preferred PPO plans. This is a true HMO, so you're required to get a referral to see specialists, and you are required to designate a primary care physician. If you don't have one, but you want to enroll in this plan, they'll automatically assign you a primary care physician, and you can always change that at any time. All right, Blue Care Direct with Advocate. This network is an open access HMO, similar to the Bright Health network, but the only care partner here is Advocate. So when you select the Blue Care Direct plan, you have access to any Advocate facility or specialist, no referral required, but you are restricted to the Advocate network. So if you normally utilize Advocate Healthcare System, like you only have doctors with Illinois Masonic or Lutheran General, this can be a great option for you. And lastly, Blue Focus Care HMO. This is a micro network available in Cook County only. It's the most restrictive network, but for that reason, it's also the most cost effective. Ambetter and Cigna, the other 2 carriers I mentioned, they each have a network comparable to this one in size. Ambetter Balanced Care and Cigna Connect HMO networks. Okay. Kind of just a brief, how does health insurance work? It's very exciting. I know many of you, it's not the #1 thing on your mind, but I just want to give a little bit of education on the way that these plans are structured and how they work. When your coverage kicks in on January 1st, Everything is going to be subject to your deductible except for copayments. So I showed an example plan here, $20 copays. Day one, you go for a primary care visit or visit an urgent care facility. That's subject to that $20 copay. Anytime you see a dollar amount, that's going to be day one benefits. Anything outside of that is going to be subject to your deductible. Once you've met that deductible, your coinsurance kicks in. So that's going to be the percentage that you see on a plan. A typical coinsurance split is 70-30. So you would pay the lesser amount, the 30%, and the carrier covers 70%. That coinsurance split continues until you've met the out-of-pocket maximum listed on the plan. Then the carrier, once you meet the out-of-pocket maximum, would pay 100% of your bill up to an unlimited amount. This is a big, this is really why you get insurance, health insurance, is to have that cap on you for worst case scenario were to happen. The carrier would cover you at an unlimited amount. And that goes for major medical only. The short-term medical plans I touched on, they have typically a cap of about $2 million would be the most the carrier would pay if something happened to you. Okay, tips on selecting a plan. So I work closely with a lot of individuals, and I really like to focus on their priorities when it comes to their health. If it's seeing a specific doctor, for example, like if you have to see a doctor that's within Northwestern Medical Group, that would help us narrow down your options to the Blue Precision HMO and the Blue Choice Preferred PPO networks. That's a good place to start looking. Did you meet your deductible this year? If you've never come close to your deductible, you really don't plan on using your health insurance, maybe you want to consider enrolling in a high deductible plan, opening up a health savings account to kind of help lower your monthly costs. If you have expected medical procedures and you know you're going to meet your deductible right away because you have surgeries planned, scheduled, you may want to select a plan with a lower deductible. Okay, and lastly, our support and guidance. So everything I touched on, just our personal touch, hand-holding when it comes to picking a plan, helping get enrolled, bringing clarity to this market. We are here to provide recommendations and help you find the best plan for your needs. You have access to a team of licensed agents, including myself, who can help you search your doctors, look up prescriptions, and even dispute claims. I think that's it. Yep.
Great, thank you, Grace. And just to kind of recap for everybody, we did cover two essentially parts in this presentation. One being benefits available to business members of the LGBT Chamber of Commerce with Aetna and Metlife. And then the second portion, although they're special benefits, we did, Jeremy asked us to touch on this just because we are in this open enrollment period right now. So please feel free to, if you have any questions, to either unmute yourself or in the chat. We'll be happy to help on both the answer questions on both the group side and the individual side. And
thank you for the
from Danielle.
I had a question. Thank you so much for the presentation. On the group side with the Aetna, is that an HMO plan or a PPO, or are they different plans available, or how does that work?
Yeah, great question. All the plans that Aetna has are actually going to be PPO plans. So they are all very, there's none of that, the restrictions with an HMO, they're all going to be PPO as well as being nationwide. So they do have networks that maybe are a little bit more smaller, but they're all going to be PPO where you don't need that referral. And Danielle asked if Grace, can you share your email address in the chat? I'm sure Grace would be happy to, so I'll go ahead and.
Definitely.
So I would say on any individual inquiries or questions, if you want to see quotes, Grace would definitely be the best resource to reach out to. So please, say, I'm not speaking for you, Grace, but I'm sure you, please feel free to reach out to you.
Yes, no, definitely do. I'll even provide my direct line here for those of you. I know this is one of the things that's a webinar with others on. There's not always a time to ask questions related to individual health insurance, so I get it.
All right. Are there any other questions? Not, you got contact information to follow up. I believe Jeremy said he's going to have this as a recording. But if there's nothing else, thank you very much, everybody. Do appreciate your time on this Tuesday. So have a great rest of the day, and we look forward to helping everybody out.
Thanks, everyone.